technical nor scientific, then we need to create this, elaborate and strengthening this partnership that has been really a great pleasure to be together on all of this. No doubt that I don't need to remind you the reasons why this is so important to work together. By coincidence, or maybe it's not a coincidence, the more vulnerable people to neglected tropical diseases are the vulnerable poor groups that are exactly the same, that they do not have access to safe water, sanitation, or hygiene. So for us, our target group is really very well defined. We have the interventions, and now then we go for something ambitious. We are all convinced for it. We have the meaning, we have this partnership, and we will be very happy to contribute to this renewed roadmap where we clearly need a very important role for WASH, and we are there to support that and to promote it. Thank you for your attention, and thanks all for your incredible engagement commitments. As I say, we are in exceptional times, so the minimum we can do for the society is for those public health issues for which we can have an outcome quickly and a result quickly, we should do it as soon as possible. Thank you.
Brilliant. Therese, you've just heard Maria there. Washing hands, it's a very simple act that many of us are fortunate enough to not give a second thought to. Here we are, though, imploring the relevant stakeholders about the need to make this very simple hygienic act transform the lives of the most vulnerable. UNICEF created hand hygiene for all to achieve universal access to hand hygiene. How do you see UNICEF and other WASH stakeholders supporting hand hygiene for all? And what's more, how can this be mainstreamed into other areas of work?
Yeah, thanks for that, Patricia. And I think it's UNICEF and WHO together that have come together on the Hand Hygiene for All initiative. And if you think about it, it's about hand washing for everybody, everywhere, and all the time. So there's no choice but for everybody to join us. It's going to be a great party and a great way to go ahead for us all to come together. If you are the owner of a business, or you're the Minister of Industry and Commerce, or you're the local bus operator, it's going to be worth your while joining the movement on hand washing, because the benefits that's going to come to your staff, to the wider community, to everybody is going to be amazing. And I think, as Maria alluded earlier, you know, the whole issue around access to water, access to soap, access to facilities, how do we ensure that people have access to the facilities that they need to practice, but also how do we assist them as individuals to practice and to change their behaviors? It's about not just about information exchange and knowledge. We know at the moment under COVID, we've got about 96% of people will respond that they know they should wash their hands. But once the fear factor starts to drop, we'll start to see less and less people washing their hands. So how do we now get in, reinforce, and how do we now get in and do that? I think we've got great learnings in the WASH sector, and I think it's a real question of sort of building on those learnings. If you look at a lot of the learnings around sanitation, where it's gone beyond the Ministry of Health or the Ministry of Water or Climate Change, whoever does it and it's about really bringing all stakeholders together on this. I think the private sector have a huge role to play. I think the public sector have a huge role to play. Schools, communities, health centers, everybody has a great opportunity now to contribute to this. We as UNICEF hope to work with all of the partners, establishing partnerships at country level with the ministries and basically developing roadmaps. But I think the most important element of the roadmaps is to make sure that we can cost them so that hygiene becomes something you can invest in. It's not just an outcome of something that's not an investment plan. And I think that's sort of one of the big things we can do, because if we don't, we won't get the level of funding and the level of ambition that would be required to really take this to the level that it deserves. We'll still have small little independent hand washing promotion campaigns going on, rather than a global movement to make sure that we all wash our hands everywhere and all the time.
Yeah. I agree with you. I'm sure we'll be talking more about changing behavior and of course about investing later on in the program today. Now, this reality, you know all too well, Dr. Kaningire. There is acute water stress in almost a third of African countries. This affects an estimated 330 million people who live in rural areas on the continent. Now, with the existence and support from these global initiatives that are being talked about, or will be talked about as well, what is being done to relieve this heavy burden from the lives of so many? Let's start there. Yeah. Dr. Kaningire.
Thank you very much, Patricia. I will start by those statistics you talked about, the number of people who lack access to safe drinking water. We have more people lacking access to sanitation, and the investment is not very promising. We are talking of almost 700 million people lacking access to sanitation, and many still practicing open defecation. Therese talked about hand washing, and we know in sub-Saharan Africa, we have more than 767 million people who have no access to hand washing facility, just water and soap. So this is an alarming situation for AMCAO. And our first thing as AMCAO is to bring this situation to the government of African continent in general, but also alert in a special manner those of sub-Saharan Africa, where we have the statistics which are more alarming. And we link that lack of access to water to some of the impact of that lack of facilities and services. For example, these diseases, NTDs included, and also the economic losses that our countries go through. And AMCAO has been acting at many fronts. The first one was to provide evidences through the monitoring of water and sanitation sector and reporting to the high-level leadership of Africa. And here we go to ministers, but also reach the Summit of Head of States through the African Union. And this is like to change the way decisions are taken and promote decision making based on evidence. Another thing that we tried is also to alert countries on how policies are formulated. You can't have good plans and a very focused implementation if, to start with, your policies are not aligned with the key commitments which are taken at the continental level or at the global level. And here we have been supporting countries to improve their policies, but since 2017, we found that working with individual countries was not really accelerating the pace. And we are now developing the African sanitation policy guidelines so that we can reach all of them. And this is accompanied by a lot of advocacy at different levels so that we can really achieve access, universal access to water, sanitation, and hygiene facilities and services in all the continent.
Okay, you mentioned there's much knowledge sharing and advocacy going on between the different stakeholders. The AMCAO, as you call it, was set up in 2002. Has there been any tangible progress that has been made since then, with the different countries?
Oh, yes, I would say when we look at the last report, which was published in 2019, on the WASH specifically, at
Yeah.
least on, first of all, on the enabling environment. There is a lot of achievement and institutional arrangement on that, and that is the focus of AMCAO as a policy organ. That is one of the achievements. But also on this capacity building, where countries start alerting people and sensitizing communities so that they can be a behavior change to adopt the right way of doing things. And during this COVID period, we have gotten a lot of calls from ministers on how we can coordinate all the players, including outside overseas organization, on how we take together and create more collaboration, more synergies to and more lesson sharing so that we can push the agenda forward.
Brilliant, brilliant, brilliant. Okay, let's turn to you now, Ellen. The End Fund has also been increasingly investing in WASH interventions. And just like many others, even more so during the COVID pandemic, could you lay out how your work will contribute to the sustained outcomes we desperately need to see happen?
Thank you so much. I'm delighted to be here, honored to be a part of this panel, and just so excited for this discussion. I think that so many of us who are development practitioners and want to get into the technicalities, we do start thinking, I mean, from the End Fund perspective, we've been wanting to use this moment of COVID to support more hand washing campaigns. We can't, the world is talking about hand washing, we can't lose this particular moment. So we have funded things like distribution of soap and hand washing clubs in schools and community total lead sanitation projects, building whether it's tippy taps, really looking at what, how can there be more coordination. But I do feel when I reflect on our sector, it's so obvious, the linkages between NTDs and WASH and the things we need to do. Hand washing, it's so simple, it's like amazing that we're still talking about that. I love Therese though saying what we need to have is a global celebration. Like this is a big part of washing our hands. I love that. I love that, Maria's like, what we really need is more conviction around it. And when I think about the interventions, so many of the interventions are the simple ones we've been talking about for decades that we've been working in this sector. And I think of that Krishnamurti quote that's like, to be intelligent is to be simple, but to be simple is extremely arduous. Yeah. And I think what's missing, if we know so much of the interventions, and I actually was taking a walk around the neighborhood this morning, and in this moment in time, and especially in US history, like the conversations on racial justice are so strong. And I thought I would share with people, I thought it was amazing because there's signs everywhere on Black Lives Matter. But this one sign I saw today was, we believe that Black Lives Matter, no human is illegal, love is love, women's rights are human rights, science is real, water is life, and injustice anywhere is a threat to justice everywhere. And I loved that water was in there. And I thought, it's not a mistake. It's like water is a human right. Water is linked to the racial justice agenda. It is racist that we don't have water and access to hand washing for everybody on this planet. Like, who is actually suffering? And I think that sense of like anger that it brings up for me and for many of us, it's like where I think I'll highlight that conviction. Like, where is the political will? How, I think about, when Modi first became president in India, or prime minister, that, he's like sort of having access to a toilet, a top agenda of his first 100 days. And there's a campaign about like, don't say I do unless you have a loo. Some people probably remember that. And I just like, where can we get, the dollars are not going to be unreleased. The political will is not going to be unleashed unless people, I think, really embrace this as water and sanitation and hand washing actually is fundamentally tied to human dignity and to human rights. And so I just love that this kind of conversation is happening, because I do think we need more and more linkages. Like when I get back to the practical, we can get very much in our own silos about what we're doing and what we're working on. And I think that this opportunity to create more linkages, to elevate the conversation, to have collective advocacy. I also think when I think about ambition, the End Fund's particular role is to work with private philanthropy. And there are some amazing examples. I was so happy to see that Nebiyu from the Children's Investment Foundation is a panelist today. SIF is doing some incredibly ambitious things, willing to put in money, willing to push boundaries. I mean, those of you who follow like the Hilton Foundation, Elma Foundation, the Gates Foundation, their whole entire initiative of reimagining the toilets. I do think that this opportunity for private philanthropy to support, take smart risks, be catalytic, and really, you know, potentially fund the things like coordination that may not be happening. But I just really thank again WHO for bringing together this group, and I'm excited to work with many of you in this next phase of reaching our goals.
That's great. We're going to just continue talking, to be honest, but I realized that we need to go into questions at this point, which have already started coming in. A question for you, Maria. What do you see as the biggest barrier to WASH progress in NTDs to date?
Let me tell you what I don't think are barriers. I mean, we cannot use as an excuse of a barrier the fact that we lack scientific evidence. Certainly not. We cannot say that we are lacking cost effectiveness studies or cost efficiency or even financial investments and benefits, cost benefit analysis. That's not a barrier. We have thousands of papers telling us how cost effective, cost efficient, cost benefit. So you name it. We still, again, recommending hand washing and access to safe water and sanitation and hygiene as one of the most basic and extraordinary public health interventions, and we still don't have it. So what is the barrier? Let me be a little bit provocative here. I think it's blindness and human ignorance. I cannot see other one, because I will not accept that the barrier is, oh, we don't have enough evidence on the interventions that works.
No.
If you believe on human rights, if you believe on gender, if you believe on leaving no one behind, if you believe on all of those slogans that we have been using and still promoting public health, I don't see any reason why or any barrier that will be acceptable, except, as I say, maybe human ignorance or blindness on what a good investment is about it and how human rights are very much at risk here. So we start by saying that we leave no one behind on the SDGs, but in fact, we are leaving a lot of people behind. So if you really want to be serious about that, start providing access to safe water, hand washing facility and sanitation, and finish with those diseases that can be eliminated or eradicated because you have a very cost-effective intervention, full stop, no excuses, no barriers. Have other barriers that they can define, but...
Yeah. Dr. Kaningire, a question for you here as well. We frequently come across basic barriers such as separate budget lines. How do we get the financing right to support better coordination and integration? That can go to Ellen as well, I think. But let's start off with Dr. Kaningire.
Yeah, thank you very much. For now, I would say we are still heavily funded by philanthropics and development partners. But our effort is to bring our government to understand that these are things which are needed. Coordination, learning from one another. So this peer-to-peer learning. We do the technical work, but we need to reach out to countries and have them sustaining all those activities which are initiated with contribution from different development partners. I think what is being seen currently and what we want to break, Maria talked about blindness, but I will add there is two other things which are shameful. There is also selfishness and a sort of shamelessness because some of these diseases can be indeed eradicated if there is proper decisions putting first things first, and the resources can be available at country level. And this is what we want to bring our ministers to, what is our stakeholders, and at different levels, private sector. We should not feel safe and happy when we are surrounded by all those miseries around ourselves. And there is something we can do. The call for action is repeated, and I'm taking this platform again to call for action, however small it can be. It will certainly create a big impact.
Okay, one more question before we have to move into our next panel. For Ellen, for NTD donors, what WASH interventions are the best investments?
Oh my goodness. I mean, I'm with Maria that there's no lack of scientific evidence, and there's no lack of cost-effective solutions. I think the best investments is I wouldn't pick a specific intervention. I would say the best investments are the ones that actually address the unique situation of the community and that the community is involved with selecting. I really feel like that, I wouldn't go down the list of saying, oh, you definitely should fund this type of well over community-based total sanitation. I honestly think it's incredibly contextual, and the most important thing is, that solutions are community-led, country-owned, and that there's a real sustainable framework around them.
Brilliant. Thank you so much. You guys have been a great starter for the session today. And thank you for sharing with us, and thank you for the questions. We're going to just have a quick, brief visual break before we dive into how best we can maintain and grow on our efforts.
We all are aware that one of the contributing factors in this long-standing battle with NTDs is the lack of access to safe water, sanitation facilities, as well as poor hygiene practices, especially in tropical and subtropical countries like the Philippines. Although I know it's a bit challenging to improve and implement our efforts in WASH, considering that it really takes a while before we see some impact in terms of behavioral change. But being in the public health sector, who doesn't love challenges? I believe now is the perfect time, more than ever, to focus our efforts in WASH as well as streamline our strategies, because WASH will not only be a solution to NTDs but will also help in curbing transmission of COVID-19.
Unmute. Thank you, Paula, from the Philippines for that. Rising to the challenge. What does that mean to us all? Are there spaces where, more cross-sectoral opportunities exist? How can this be used to entice new partners in order to achieve the roadmap targets? Overall, it's a comprehensive approach that's needed, which of course requires investment. Speaking to this, we have on our second panel, Chilufya Chileshe, Regional Policy Advocacy Manager at WaterAid. We also have Fatumata Barry, Health Specialist at the World Bank Group, Nebiu Negusu, Director of NTDs at the Children's Investment Fund Foundation, Africa, and James Wicken, Head of Global Policy Advocacy and Innovation at Water Supply and Sanitation Collaborative Council. Welcome to you all. I'll start off with you, Chilufya Chileshe. I could see you getting set up earlier. Now, WaterAid specifically works to improve the lives of the poorest communities in the world through WASH. And I'll go back to that point about it being one of the most cost-effective health interventions with huge rewards. There's great motivation right there to engage with the NTD community, right? I mean, you can tell us how your organization is investing and collaborating.
Thank you, Patricia. So I think that we have heard some really great reflections at the beginning, and a lot of those just kept resonating with a lot of our own belief about what needs to happen with regards investing in NTDs and WASH for the kinds of results that we need to see. So at WaterAid, we have spent some time looking at what exactly are the problems with regards how investment is happening in WASH and in NTDs. And it's very clear that because investment in WASH has been deprioritized, I won't use a strong expression as ignorance used earlier, but definitely deprioritized. And what that means is that we have very many communities that are going without clean water that is needed to wash their hands, to wash their faces, to prevent blinding trachoma and all of those things. And so what we're doing is really making a case and calling on governments everywhere in all of our work to make sure that there's concerted effort in increasing financing for WASH and for NTDs. Yeah. We think that it's important that there is a co-locating of WASH and NTD interventions to make sure that we are addressing the problems head on, but in a comprehensive manner. And this is where we see WASH playing a role of being a maker and a marker of progress, because normally, you know, where WASH services are poor, NTD pathogens, you know, will thrive. And so trying to understand how we finance WASH using those NTD indicators as a guide for where people are vulnerable is a very important thing. And that's what our work involves, is trying to make that case, trying to understand exactly where communities are vulnerable and targeting interventions in those areas. Yeah. We also find that working to support coordination is a very important effort that we are doing. And we all must work towards doing even more. Coordination that is embedded in national processes. It's great to have projects that co-locate or align or try and bring WASH and NTDs together, but it's not enough for the kind of sustainable change we want. We need to make sure that government systems are embedding coordination mechanisms, you know, in every intervention, in every funding opportunity that we have, that we are including coordination components that support that strengthening of national systems, that there's a speaking together of people working on NTDs and on WASH, using that data together, planning those interventions, targeting the communities that are vulnerable. And there has been mention here about the effects on women, the effects on children, you know, on gender equality if we don't get this right. And we have to get it right. So it's crucially essential that we are understanding the needs of especially those communities that are vulnerable to NTDs, because it usually also tells us that something is not working with regards to WASH. You know, either an investment has been made, but the infrastructure cannot be sustained. Behavior change communication has been done, but there hasn't been communities haven't been able to sustain those hygiene behaviors, either because the infrastructure is not functional, and sometimes we find the infrastructure is there, but the water doesn't flow, you know, as it should. Yeah, and this is in schools, in healthcare centers, and in communities all around. Yeah. So our work is really to try and champion those things, because we believe that they are the place that we need to begin to strengthen this response.
I like what you said, it's the maker and the mark of progress, but you mentioned so many other things there that are necessary. Supporting coordination that's aligned with national processes, speaking together in a unified voice, you know, inclusive interventions as well. Fatoumata, let me come to you. There are already large portfolios on both WASH and NTDs at the World Bank. How is the World Bank Group working to bring the two together?
Thank you so much, Patricia. I'm really glad to be part of this conversation, and I think it's really been a fruitful one. And you know, just going back to some of the different messages that we heard even in the last session, really the central message of the SDG is to leave no one behind. Right? This is what guides us and many other international organizations. And as some of you may know, the World Bank in 2018 launched the Human Capital Project, which is really a central driver for sustainable growth and poverty reduction by making the case to countries that investing in people improves their quality of education, health, and the environments where they live and work to become more productive members of society. And one of the key elements of this Human Capital Project is really to increase the multi-sectoral interventions, which in the health sector has a large focus on improving the nutritional outcomes, which we know NTDs are known to compromise. And this really signaled to senior management that more has to be done, right? However, we also know that it's usually very difficult to implement cross-sectoral projects. Not only do you have to get the right project developed, but you have to ensure that there's commitment at the government level. across the relevant ministries. And during a pandemic, this can even become more difficult as we see shifts in international donor financing, even in domestic resources, to adjust to our new reality. And we had a study done in June that showed that COVID-19 is expected to push an estimated 71 million people into extreme poverty in sub-Saharan Africa alone. So what are we really doing at the bank regarding NTDs and WASH? And since 2009, as Patricia has just mentioned, the bank has financed an estimated 2.9 billion for WASH in sub-Saharan African countries. And that's those countries that are considered high or borderline high risk in the bank's 2019 NTD index, which uses about 13 indicators to really account for the burden of NTDs. And for us at the bank, we really needed to learn more about the investments and whether or not health, or more specifically, NTDs were used as investment criteria. And we did find less of a focus on NTDs, unfortunately, in terms of the WASH investments. However, there were several investments that were really geared towards improving various health indicators. So I feel like we are getting there. And so what we knew at that point is really that we needed to build the awareness and disseminate knowledge on NTDs, not only externally, but really internally. Really change how people are thinking about these issues. And this is where we decided to really kind of focus on working as in the health sector with the water global practice to really make sure that there's more inclusion of health and NTDs in some of their flagship reports, and also to make sure that we provide more knowledge about NTDs and the links with WASH. One other thing that we also did, we used GIS to conduct a spatial analysis of WASH investments and NTDs in several countries to showcase to governments, what can be done and how we can do it better. And as many of the panelists today have discussed, one of the key elements to making sure that WASH investments are really targeting NTDs and reducing that endemicity is really trying to make sure that all three dimensions of WASH are included in a project. And so we're really hoping that as we move forward, that we'll really be able to push that a bit more. That it's not only about cross-sectoral work, but it's making sure that we don't leave out hygiene when we're doing water or sanitation projects. And we're really glad to see that WASH is being highlighted so extensively in this new roadmap, which will really enable the bank to continue to progress on some of this work. Thank you.
Fatoumata, you're going to be our point person. We need to get people to understand this more. Let us know what you need. Nabiyu, you're with us as well. How does the Children's Investment Fund Foundation view the association between WASH and NTDs? And given that advocating for WASH services has taken even greater importance now, what is CIFF doing to keep the momentum going so that the most vulnerable in informal settlements, migrant camps, and in areas of armed conflict, for example, are at the very least safe from the ravages of disease? Nabiyu.
Thank you, Patricia. I'm really happy to be the part of this forum. At the Children's Investment Fund Foundation, we are working in improving the lives of children by having a bold, innovative ideas and create a sustainable environment by a means of resilient communities. So at the foundation, we strongly believe creating a resilient community will enable us to achieve the global sustainable development goal agenda. And our resilient community as a strategy focus on addressing NTDs, eliminating and eradicating NTDs, creating water, sanitation, and hygiene access, as well as addressing adolescent nutrition and climate issues. So by doing so, we believe that we can create a strong, resilient community that goes beyond the sustainable development targets that we collectively have. in 2030. So in our NTD, in our way of seeing the association between WASH and NTD, it is just like a perfect marriage between two couples. So in our NTD investment, we make sure that behavioral change communication, water, sanitation, hygiene are included as a means to impact NTDs, together with other intervention, one to keep the momentum, two for acceleration, as well as to sustain the wins that we have from our current investment. Similarly, in our WASH investment, we make sure that in our metrics, we prioritize NTDs as one of the criteria for selecting countries, as well as regions and district localities in our prioritization, and making sure that we are addressing NTDs in our WASH investment, and we are addressing WASH in our NTD investment. So in our NTD investment, actually mainly focus in Africa and India. Currently, we have more than 6 investments under the area of NTDs, focusing on trachoma, schistoestate, Guinea, as well as lymphatic filariasis in India. In all of our investment, we have WASH as one of the implementation pillars that will help us to achieve the elimination and the eradication target. And currently, we have the WHO NTD roadmap that help us to enable to focus on sustainable development and aiming for larger, more ambitious vision, which is elimination and eradication. So in all our current active investment that we have at the foundation, we are integrating WASH as a part of our investment. And again, in WASH investment, as I said, we are prioritizing entities as a part of one main big criteria alongside other criteria in our investment in different Africa setup. So those joint intervention will take countries, continents to move forward to be able to achieve the 2030 global NTD roadmap goal. And the other thing at the foundation, we are not only doing WASH and NTDs, but also we inspire in our philosophy and believe that other donors and other different countries to really see the value of having WASH and NTDs implemented in an integrated and coordinated fashion to be able to achieve the 2030 goal. Thank you.
So there's lots of is that yeah. Somebody needs to mute their mic, please. Yeah, there. That's sorted. Okay, so there's lots of investments, and the momentum is building. James Wicken, your organisation is evolving into the Sanitation and Hygiene Fund with a core focus on marginalised and vulnerable populations. And I mentioned a few vulnerable groups a few minutes ago. How will the new fund encourage collaboration with the NTD sector to help deliver WASH services to these groups?
Thank you, Patricia, for the introduction and the opportunity to join the important session today. As you mentioned, the Water Supply and Sanitation Collaborative Council is evolving into the Sanitation and Hygiene Fund with an official launch taking place at the end of the month. And I'd like to say a few words about the potential for this new funding mechanism to simultaneously incentivize some of the collaboration you talked about there, Patricia, between sanitation, hygiene and NTD issues and target the key populations. The Sanitation and Hygiene Fund is being styled on other successful global health funds as a financing mechanism to address the sanitation and hygiene crisis in the countries with the highest sanitation burden and the least ability to respond. And how the mechanism will work is, those countries will be invited to apply to the fund, and applications will need to be aligned to costed national strategies and plans. And we heard Therese refer to those earlier. And the fund will also have investments to develop and strengthen those plans where they don't exist. And I think herein lies the first opportunity of the new fund. It will encourage applications to align with and therefore support delivery of the national NTD roadmaps where they exist and where they're going to be strengthened. The applications to the fund will be co-designed through an inclusive, consultative process working across sectors, particularly with health sector. And I think herein lies a second opportunity to bring in the focal points for NTDs to be a part of the existing multi-stakeholder platforms at the national level, where perhaps this might not always be happening. And I think that gets to addressing some of the silos that, Ellen, that you mentioned earlier are crucial for breaking down. One of the decisions that these multi-sectoral coordination mechanisms will have to take is where to geographically target investments from the fund. And there will be a strong leave no one behind lens to these decisions, using the data we have on inequalities and access to sanitation and hygiene to target investments towards the marginalized groups. And this is where I see one of the real opportunities to build on this integration with NTDs by making use of the available micro assessments, on kind of NTD hotspots at the national level, which Chilufya and Fatima both talked about earlier, to really bring about this co-location of interventions. And I think the draft roadmap that you shared before this meeting really explains that we would expect to see an overlap with these two data sets, with NTDs being typically situated or more prevalent in areas where there are greater poverty and vulnerability. And for me, this mapping is really the crucial element that enables joint planning, joint programming between the sectors. And I think it lies at the heart of a lot of the success stories and the frameworks that are put forward in the draft roadmap. So looking ahead, I think, Patricia, it's important to ask, a couple of questions I've been asking myself in the lead up to the webinar. What more can we do to make sure that the existing micro-assessment data is reaching the right people? We have some of that data. What really prevents it from happening at the country level, and what could we do to overcome that more often? And how can we broker these relationships between the NTD focal points and WASH sector planners again? And I think the discussion today, the roadmap, provides a platform to reignite these discussions again on convergence at the national level. And in the Sanitation and Hygiene Fund, as we become operational into 2021, we will play our part, and we would really welcome any follow-up dialogue with people on the call today on how best this can be done and how it can be built into the future programmatic guidance that will be kind of directing how these fund investments work. So thank you for involving us at this critical juncture today.
Thank you so much, James, for laying out how it all works. And I'm sure you'll be speaking to quite a few people after this anyway. Now, loads of questions have come in already. Let's start with you, Chilufa. What is the best strategy to ensure sustainability of WASH in countries and territories heavily affected by drought? Chilufa. I'm not sure whether she's there.
Yes, I'm here.
Okay.
Yeah, so that's about sustaining WASH services for communities affected by drought. So we at WaterAid, we are really following closely the effects of climate change on access to water, sanitation and hygiene services. And this is an area we think is quite a critical one, because as much as we know that the enormity of the problem we have to deal with, is such that it requires a lot more money than we currently have, but then it becomes even more exacerbated by droughts, and sometimes it's flooding because water then gets contaminated and things of the sort. So it's a lot about ensuring that there's planning at the country level, and that there's investment in capacity to understand who is most affected. That has always been one of the areas that requires robust attention. What makes communities vulnerable, and what are some of the things that are undermining their ability to continue enjoying access to water and sanitation in a sustainable manner. A lot of the time, it's those country systems that have been referred to here that enable that an understanding of vulnerability is done, and that a targeting of investment is appropriate to those communities. So the challenges are very many and they are varied, and these issues around where water is scarce requires long-term planning as well as short-term understanding of the immediate challenges. So we at WaterAid working a lot at national level, trying to support those country systems, understanding, monitoring where people are affected, monitoring where the money is flowing or not flowing, and trying to make sure that we can redirect it to people that are most vulnerable, such as the ones referred to.
A question for you, Fatima, and it actually points to something that Chilufya had mentioned earlier about, inclusive interventions. Fatima, do you think investing in WASH will help to address gender issues, and how can this be done?
That is a very good question. And I do think that that's definitely something that's possible. In terms of WASH, we all know that usually WASH interventions usually provide more benefits for certain people, usually the most vulnerable groups. And so women and children tend to be part of those groups. And I think that it would be really important to go ahead and do that. The other thing that I think that would be important is how do we make sure that we're really getting WASH interventions in areas, and I think we were discussing this a bit earlier, in areas that are also the most vulnerable, and that could be those that are related to climate change and how they're being impacted, and also other environments as well. So yes, I think that this is absolutely necessary, and it will definitely change the dynamic for women and children in the years to come.
We all know, as soon as Mama has got the water, she will make sure everybody's washed their hands. And
absolutely.
So question here for you, Nebiyu. I've got so many questions, and I know this is going to overrun, and I'm hoping that it doesn't, but still, Nebiyu, in your experience, what are the key factors which are needed to change human behavior in WASH? Budgets, information, what is it?
It's a very tough question. So, yeah.
Big question too.
The most important factor, I believe, to change one behavior is the desire to live a healthy way of life. In order for them to have a desired behavior. Behavior is a very.
It's a bit strange right now. I'll put the volume down a little bit. Let's try again.
Yeah. Sorry, I can't hear you. What do you say, Patricia?
Oh, you couldn't actually hear me. The sound is a bit strange. I actually hear myself right now. There's something on. Perhaps you can switch it off and then respond to the question.
Yes, it's raining outside. Sorry for the background noise. I think the desire to change one's behavior, the desire to have the right behavior and attitude is for one desire.
I'm so sorry. I can't make out anything. So just hold on to your response. Switch off what you have going in the background, and then we can return to you. James, I've got a question for you too. How can we generate political will to integrate or align often separate and misaligned programs for control of NTDs and for WASH?
Yeah, another good question. I think it comes a lot back to the kind of fundamentals of the sector. And I mentioned, aligning behind sector plans, making sure that those plans are there. And that gives different partners, an opportunity to invest behind a national plan and for different sectors to coordinate behind a national plan. We heard quite a lot about coordination and the key role that plays. I think, there's a kind of a technical systems strengthening lens that we can look on those things. But then when you dig into the case studies, then there's a kind of a leadership element that always comes to the fore, where you find, you know, someone who's playing that kind of catalytic champion role to bring them together. So in my experience, you know, it's both of those things. It's a little bit of the systems thinking that makes some of this sustainable, but you need someone, it doesn't just work by magic. You do need to that little bit of ingredients that comes from leadership and charisma to break through some of these quite ingrained silos. But there's plenty of examples, I think, in the roadmap and the other documentation of the last few years to show how that can be successful. And the success stories that were shared at the start of this call are a great inspiration about you know, how you can do that and how the impacts that it had. So, yeah.
Okay, thank you. Nabiya, can we come back to you? How's your sound now?
How about now? I think.
Oh gosh, it still sounds really bad. I'm so sorry. We want to hear your voice. We want to hear your voice, but thank you so much. I have to end it there because we've run over a little, even though there's so many other questions that, you know, were posed to the four of you. Thank you so much. That's not before we move on to the third panel. We have a short visual break so that we can listen to some of the voices from the field. Thank you so much.
To end NTDs, we must prioritize WASH.
Water sanitation and hygiene plays a very important role in lymphedema patients.
I consider WASH as an important strategy in preventing and controlling the transmission of communicable infections like some neglected tropical diseases.
And good quality of water in a sufficient quantity is the basic need for the survival of any individual and human being.
To achieve the universal health coverage, WASH and NTD have to work together.
Proper drinking water and sanitization can prevent diseases like cholera and diarrhea.
Water and sanitation is base for life and base for your health also. Because whatever we consume is indirectly or directly related with your health.
They have been teaching us to always wash our faces and our hands to prevent trachoma in our daily life, because trachoma is a disease which affects the eyes. We may be blind if we don't practice washing our hands and our faces.
Wonderful. A few pointers there. Prioritize WASH strategies, the need to work together to achieve universal healthcare and the SDGs. Water being the basis of life and survival. We've heard that a few times, of course, today. And the various diseases that can be impacted with WASH services at play. Well, what does that mean in real terms? On the ground, collaboration, coordination, and integration. Operationally, it takes time, resources, human power. Who needs or who's going to sign the papers? What does progress in action entail is the next big question. Our panelists, Samuel McCoy Yibi, Director, South Sudan Guinea Worm Eradication Program. We've got Fikre Seife, Team Lead, NTD Programs in the Federal Ministry of Health in Ethiopia. And also joining them, Aya Yajima, Technical Officer, Malaria and NTDs at WHO. And Zainabu Kalu Mahamane, Cross-Sector Program Manager, World Vision Niger. Right, let's start with you, Samuel. Community-based interventions, I knew we were going to come to this, and behavior change were instrumental in bringing about a transformative shift in South Sudan's Guinea Worm Eradication Program. How did working with WASH play into this specific success story?
Well, thank you, Patricia. And I think progress is being made in South Sudan because for you to see it, you just need to see the numbers of Guinea worm cases.
Yeah.
In 2006, we had over 20,000 cases. And to date, we only have now, 2020 to date, we only have one case, one case so far. And again, I think the whole engagement with the WASH, I think goes back to when we started the Guinea worm eradication campaign in South Sudan after the civil war in 2000, the Comprehensive Peace Agreement 2005, that ended the longest civil war in the country. And at the time, the statistics were very there. You are looking at the statistics that shows that in Southern Sudan at the time, the access to safe water was something like 27% of the population can have access to safe water. Sanitation was something around 15%. This is looking at the population of about 8 million people. Now, there was also definitely a disparity between rural versus urban settings. So actually that the disparity shows that there was actually a 10% difference between access to population to wash services in rural setting compared to urban setting. And you can see a situation where around that time, the government of South Sudan at the time was developing a water policy. And the whole process was confronted with a challenge where if they have to come up with a mechanism of allocating safe water or wash services, what formula do they use for safe water allocation or for sanitation service allocation? And I think at the time, we, as a Guinea program, we happened to be part of the engagement of the discussion. And clearly, I think a consensus was reached that providing wash services to Guinea endemic communities and targeting Guinea as a disease that is slotted for elimination and eradication, we can see a situation where we have a measurable impact here. And I think that actually made the wash sector partners, especially the Ministry of Water Resources and Irrigation and all water sectors in the country, to see and prioritize allocation of water services to Guinea endemic areas, and especially in the area of provision of seawater. Yeah. And I think down the line, we have seen a situation where we have moved from the coverage actually doubled by 2013. Specifically in Guinea endemic areas, we were able to mobilize over 600 boreholes targeting specifically Guinea endemic communities. And of course, we use our vast network of volunteers who are engaged in the day-to-day village-based surveillance and awareness activities, also to integrate very basic hygiene awareness activities that definitely enable communities not only to free themselves from Guinea, but also to be able to look into the wider benefits of practicing very basic hygiene awareness practices, especially like hand washing, face washing, making sure that people pay attention to the issues of human waste disposal, safe human waste disposal. But I think there was also something that came up. As we were, the Guinea program, as we were making this engagement with the WASH partners and integrating WASH to Guinea, or integrating Guinea message into WASH activities at the community level, we also started not to see the need for us to engage other aspect of community livelihood, especially the vet. The fact that we have a huge sector of our community that keep animal for their livelihood. And then we started not to see the fact that you cannot be able to address the human health without also addressing the animal health. And also the fact that now we started to see also the fact of extending that network and collaboration between the Guinea program, WASH, and also other sectors in the community.
And I like that, what you just added there. It really, it's about looking into these spaces to see where, you know, human-animal contact comes in and addressing it. And I think that was brilliant. So there's so much I could say to that: political will, commitment, and of course, Fikre, indeed, institutional structures to support WASH NTD collaboration. This is essential, as you well know, from the Ethiopian perspective. And there's been a lot of work and investment going on there. So in terms of measurables, Fikre, what has been the difference that has been made to the achievement of NTD programs? I'm thinking Fikre is with us. He is. You could turn your camera on. We'd love to be able to see you. Perhaps we shall come back to Fikre. Ayayajima, I know I've seen you earlier. I'd like you to keep your experiences. Oh, Fikre's back, sorry. Did you hear the question, Fikre? Please turn your microphone on. Unmute. No, for the moment, we'll go to Ayayajima, Technical Officer Malaria and NTD at WHO. I'd like you to keep your experiences of Laos and Cambodia in mind. Both countries have had very interesting experiences in adjusting existing community-based WASH interventions to reduce NTDs. What are the plans by regional office to support the scale-up of WASH activities?
Okay, so thank you for asking this. So I just want to give maybe a little bit of background about Laos and Cambodia. So they had a very long history of the efforts to eliminate schistosomiasis. So they've been doing mass drug administration.
Sorry, Patricia. Can I continue? This is Fikra speaking.
Fikre, I'll come back to you. Aya is just in the middle of responding to her question.
Okay, so I continue. So they've been doing the MDA, mass drug administration campaign for 20 years almost, so that a prevalence has gone down so much. But then they had the experience where once they stop MDA, the prevalence goes up again because of the lack of the sanitation. They all had we all know that the interruption of transmission really required improving the sanitation. So they had a very strong interest and commitment to do WASH in addition to MDA. So we supported consultation with multiple stakeholders to identify the best approach, and then the countries were already doing, the Ministry of Health, the WASH program was already leading the program, using the participatory activities to engage community and let them understand the need of sanitation, and then empower them to build the latrine on their own. So we decided to use this as a platform and integrate NTD component into their activity, so that when the WASH community group go into the endemic community, so they educate people on the schistosomiasis, how the transmission is linked to their poor hygiene sanitation, so that they understand we are the one driving the transmission. So they are the one also to interrupt transmission. So then slowly, they started to understand, and they started to decide to build the latrine. And then also the WASH program working with NTD program together. So they also give different options of latrine. So something with different level of the cost and the safety, so that they can also make an informed decision of which kind of latrine they can build. So with all this effort, and we make it replicatable, so that the joint program, the team of WASH NTD program together at all level of central, provincial, and district level, they build a task force, and then they jointly develop the facilitation guide, so that everyone in every single community by different facilitator can train them in the same way. So now, initially, so WHO supported them to organize this team and then create a sort of a partnership. But now, after 3 years, the countries are already taking it on. We are not really technically supporting anymore. And we also provide minimum funding. And anyway, it was very sustainable funding with a minimum cost, because the country is not giving any subsidy except for those who have a very poor household. So the rest are building on their own. So the funding itself is quite minimum. And now the government of Laos is already putting their domestic funding to scale up this into the new villages. So we consider this not very fast scale up, but then they're making the steady progress. Only in Laos alone, in 3 years, they have scaled up to about 70 villages. In Cambodia, a little bit slower, but more than 20 villages. So they are building on scaling up and up. And now we introduced this experience to other countries in the region. Actually, this week we are organizing a NTD program managers meeting virtually throughout the week. And it was actually the session to demonstrate the progress of the Laos and Cambodia team. And many other countries, even the Pacific, were very interested. They were hearing, how can we get this support? And can we also have the similar, the facilitators guide that we can use? So now we are starting to discuss. But then, of course, even though the funding need is minimum, but still we need the fund to support the initial stage. So we will continue to look for the, the funding, and then continue to support other countries as well.
And hopefully they take on the ownership just as much as the ones in Laos and Cambodia did, because that is everything, isn't it? Fikret, back to you. We're talking institutional structures and all the work that Ethiopia's been doing around there. And in terms of measurables, Fikret, as I asked, what has been the difference this has made to the achievement of NTD programs? Fikret seems to be focused on something else. I shall move to you, Zainabu Mahamane. What can you tell us about the Wash Up NTD program, and how does that work, and why did you decide to use the specific methodology to address NTDs?
Thank you very much. I will speak in French. I see that there is a traductor for French.
Zainabu, if you could
Yes.
just your screen so that we can see you, please. There you are. A little bit more.
Is it okay?
That's beautiful. Okay? Fantastic. Thank you. Thank you.
Okay, thank you. So I will be my speech in French.
That's fine.
Yes, my English is not very well.
Not a problem.
Ok. Donc, merci beaucoup de nous avoir donné l'opportunité de pouvoir présenter notre approche workshop. En fait, c'est une approche, c'est un programme qui a été créé avec World Vision et Sesame Workshop. Donc, ce sont deux ONG qui ont créé ensemble, comme je le disais, ce programme, qui est un programme d'eau, d'hygiène et d'assainissement. Et ce programme s'adresse surtout aux enfants d'âge scolaire. Donc, c'est au niveau des écoles que là où World Vision intervient. Donc, ce programme est en train d'être mis en œuvre progressivement. Et c'est avec l'arrivée de ce nouveau programme Act to End, NTD's West, que cette approche a été révisée, ce programme a été revu pour intégrer les MTN. Donc, le workshop est une approche qui utilise le personnage Raya. Je pense que, en tout cas chez nous, beaucoup d'enfants connaissent le personnage Raya et comme championne d'hygiène et encourage Elmo. En fait, c'est des personnages spécifiques que les enfants connaissent. Dès que vous tapez sur Internet, vous allez voir ça. Raya et Elmo. Donc, elle encourage Elmo à pratiquer les bons comportements. Et pourquoi nous avons utilisé cette approche? C'est que les enfants cherchent à s'identifier par rapport à ce personnage-là, qui est comme une identité chez eux. Et l'approche utilise aussi beaucoup de matériel. Et comme matériel, nous avons le livre des contes, le tapis à histoire. Il y a plusieurs matériels et des images qui sont utilisés dans cette approche-là et aussi des vidéos qui ont été contextualisées au niveau pays. Donc, voilà en un mot ce qu'on peut dire par rapport à cette approche. Et par rapport à l'enseignement, c'est 8 sessions en fait. Le module que les enseignants, parce que c'est quoi l'approche? Nous formons les enseignants par rapport à cette approche-là et les enseignants ont leur propre équipement, leur propre matériel. Donc, le module de formation que eux, ils enseignent au niveau de ces élèves-là, et ce module est composé de 8 sessions. Et ils le font pas pendant les heures de cours, ils les font généralement, chez nous, les mercredis après-midi à pas cours, et ils utilisent les mercredis après-midi pour pouvoir former ces enfants-là. Et c'est un groupe qu'on choisit au niveau de chacune des écoles. Et ce groupe-là, on les appelle maintenant, ils seront les ambassadeurs. Donc, c'est eux qui vont à leur tour enseigner les autres élèves. Donc, voilà en un mot ce qu'on peut dire sur le programme je suis propre, donc wash up. Et peut-être.
I really like that. Sorry, I really like that. You know, get them young, you get them early in terms of teaching the young. Fikra seems to be on a call, so we're going to go straight to a couple of questions for the Q&A at this point. For Aya, intersectional collaboration is obvious. How, in your experience, how is it best to coordinate that? Does that make sense? Intersectoral collaboration is obvious. How, in your experience, is it best to coordinate that? Yeah, got that.
I was connected due to, yes.
Hello?
Aya, did you hear the question?
Thank you, Patricia. Thanks so much, Patricia.
Hello?
Is that Fikre?
Wow. Hello?
Sorry, Zainabu. We've moved on to the Q&A. Fikre, we are on the Q&A now.
Yes, hello.
Aya, did you get to hear the question?
Yeah, can I answer?
Yes, of course you can, Aya.
Okay, so for the intersectoral collaboration, I think the most important thing, it's always not easy for different sectors to sit together, especially for NTD programs to reach out to the other sectors to get their support. It's not easy. And probably the most important thing is that they have to identify the common targets and and goals, and also what expertise each sector, each program can share, so that it's not that one side is relying on the other side, but then each side have things to contribute. So it's like a mutual, and it's really for the mutual benefit. So both sectors have also the not only contribution but also the gain by joining the force together. Am I answering the question?
Yeah. Okay, just one more question for McCoy. Do you think WASH can do more to eradicate guinea worm in South Sudan? Just very quickly, we've got a minute.
Oh yes, definitely. I think WASH contribution to guinea worm eradication is very critical, especially in consolidating the gains of the interruption transmission as we move village from village. And I think we started from over 3,000 villages that were endemic. Now we are only about one village that is endemic. So I think say water contribution is very, very critical. So the answer is yes. Say water contribution is very, very critical.
Okay.
Consolidating the gains of interrupted transmission.
Looking forward to more successes in the work there. Thank you to our panelists and attendees for speaking to the progress made so far, with great questions and remarks as well. Earlier, I had taken note of the WaterAid quote, and if there's a simple, on-the-ground, cost-effective innovation that comes to mind, this must surely be it. Take a look.
This is a leaky tin. It takes less than 5 minutes to make one. This is a locally available material. After consuming the oil, we make a small hole beneath the container and use a small thorn as a cork. So as water trickles down, it waters the tree, and I also use the water washing my hands. It has several advantages. One, it uses very little water. It prevents cross-contamination. Apart from eye infection, it also prevents other diseases like diarrhea. This is what we use in our community, and this is what we advocate for.
Yeah, the leaky tin video has become a bit of a favorite in terms of solutions for communities living without proper infrastructure. Kudos to the team. I feel that now, though, is a good time for us to take stock of all we've seen and heard on today's forum. And so for this, I'd like to welcome Yael Velman to the fore. Hello there, Yael. You're from the NNN WASH Working Group. What have you been thinking? You've got immense, experience in tech-specific areas, so your thoughts would add great perspective here, referencing country examples in your responses where you can. How can the various NGOs align with the WHO vision? I know I've started with the big one, but why not? Let's go for the jugular and make sure that we get it out there.
Thank you, Patricia. Firstly, I'd like to say it's been really inspiring, and I have to agree with Dr. Nera that we've really achieved quite a lot in just 5 years since the Global Strategy on WASH and NTDs was launched. So a couple of things that really struck me in the conversation today. First of all, I think we've all now realized to one extent or the other that working together really makes sense in terms of achieving targets on NTDs, but also broader development and universal health coverage. And that although there are challenges, if we think it's feasible, as Maria said, we can achieve it. A couple of people I saw raised questions on Slido about, well, how can we really achieve any of this due to water scarcity? But actually the experience in the WASH sector has always been that it's not really an issue of scarcity, but of distribution. And what NTDs help us do is understand where the need is so that investment can be properly targeted. And we can make sure that we're not leaving anyone behind. As Ellen Agler also said, it's a human rights issue. I think what we also have now is an unprecedented level of experience and practical tools. Much of it was supported by NGOs. We helped develop a toolkit to deliver the strategy on WASH and NTDs. But I really have to acknowledge the amazing leadership we've seen by ministries of health and ministries of water at country level. It's a great shame we didn't hear from FICRE. Ethiopia has really been a front runner in these efforts, working very, very closely with the NGOs, but really taking leadership seriously and putting resources, staffing, and institutional mechanisms to make sure that coordination happens. And in terms of what we can do as NGOs, I think there's still a really important gap that we need to address. And that's not just the amount of funding, but the quality of funding. It's about bringing the WASH and the NTD budgets together. As everyone said, we've got enough evidence. Let's not let bureaucracy get in the way of making this coordination happen. And as a working group, we are committed to working hand in hand with WHO to deliver the vision of the NTD's roadmap.
And thank you so much for that. I was going to ask, do you think the roadmap will lead to a more sustainable change? But given your response, if there's anything to add to that, I think you've actually made the point very well. Thank you so much for that, Yael. Dr. Mwele, if I could turn to you now, as Director of Control of NTDs at WHO, who've put together this ambitious, all-encompassing draft roadmap. With all this great collaboration and support, the roadmap could prove to be quite the game changer, couldn't it?
Absolutely. And thank you very much, Patricia and Yael and all the panelists for joining to talk about this critical issue today. I really appreciate your input and your thoughts in moving this important agenda forward. When we started talking about it during the development of the roadmap, it was felt that why are people working on NTDs now starting to put targets for WASH in a roadmap? And I think that was a really critical, it was a really bold but important step that needed to happen to help us move forward. And so the discussion was, so are NTD program managers going to be WASH managers? And that is not the case. We know that the NTDs we deal with are linked to poor access to WASH, and this exacerbates vicious cycles of poverty, disease, and suffering. And the idea here is to make sure that we look at the hotspots for NTDs and ensure that we have WASH infrastructure in those places. So we've talked a lot today about the gaps, and we've heard a lot of it, of course, boils down to political will. And many words have been used today, very tough and tough words. But I'd like to echo what Ellen said, and that water is a human right, and it's a human right, period. And we really should not be making any more excuses. We have the evidence and we can move forward. But we've also heard today, Patricia, about what progress can be made when we collaborate, when we seek good collaboration between the WASH and the NTD sectors. And even in your last panel, we had some great ideas of what's been happening. And I think this should be a vision that should motivate all of us. And I really congratulate all the people who are already working across sectors to show that this progress is possible. I also want to thank the Sanitation and Hygiene Fund, because I hope that at some point the funding will be through the lens of poverty and vulnerability, and which will definitely overlap with our NTD hotspots, which are the areas which mostly need these WASH interventions. So the progress we've discussed today should serve as an encouragement. And as we look to the future and the progress we still need to make, you won't need me to remind you, my colleagues, that we need action. And I think that's been discussed from the very first panel to the last, that we are now at a crossroads, and we must choose a path towards meaningful change from vision to implementation. We cannot continue with rhetoric. We cannot just say water, 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 water and NTDs without ensuring that action comes out of this. And so I think this, like an earlier call to action from my colleague, I would like to add this as a call to action. And we really need to push together and move this forward. So in the new roadmap, we've set ourselves a number of ambitious targets, and the WASH one is one of them, but it's closely aligned to the SDG target. And that's ensuring 100% of the NTD endemic communities have access to water by 2030. Now, this is very, very ambitious, but it's one goal that we must strive towards, and we must look at it as it is, as a really, it should not be an in the air goal. It should be one that we strive to meet, because it's already in the SDGs. So we have to push forward. But this also, then, we must strive also to ensure our ambition matches our ability to collaborate, because it is only through collaboration which we will be able to achieve this. And we know that several countries which were once NTD endemic, including Japan, South Korea, and Italy, have eliminated them as a result, has eliminated them as a result of socioeconomic development and marked investments in water and sanitation. And so in ensuring our commitment to this WASH target, we're also working together with Maria and other partners to revise this new global strategy on WASH and NTDs, which will continue to be a companion document to the roadmap. So Patricia, in ending, let me just say that WASH is absolutely central to any number of the 2030 targets that we are looking at. And I look forward to working with everyone in this ongoing and ever deepening collaboration. Thank you so much for joining us today, and thank you so much for your inputs. And we know we will definitely move further and further in this, further and faster in this road to eliminating NTDs with the strong support of WASH.
I like what you said there. Pragmatically ambitious, collaborative action is what is how I've tried to sum it up.
I know it's wordy, Patricia, but the idea, you get the general gist. The idea is that we all know what we need to do. So yeah, it's not no longer an issue of discussing, and like Maria said earlier, it's not no longer an issue of discussing the evidence. It's just a matter of how do we do it. And I think that some practical ideas have come out of this session, which we definitely will be taking forward and seeing how we can discuss. I mean, the Sanitation and Hygiene Fund is an example of something that really we can start working together quite quickly.
Thank you so much, Dr. Mwele. It has been a particularly spirited conversation. I, for one, wish it could have lasted longer, because there was so much that was shared, so much yet to be shared. So thank you all so much for your contributions here today. We'll be back on the 18th of September when it'll be all about innovation. So we're also expecting large numbers on that one. So look out for the register link on the WHO website, plus on social media. For now, mask up, stay safe, and stay well. Thanks so much.
Thank you.
Thank you. Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.